Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. Today's episode is a special one because I had the honor of being a guest on my friend and fellow Notre Dame alum, Dr. Erica Bove's podcast, Love Science Fertility. We had such an important conversation about allergies and asthma in the preconception phase and during pregnancy. And honestly, it's a topic that creates a lot of fear and confusion. Women often ask, are my allergy medications safe? Can I stay on my inhaler if I'm trying to conceive? Should I stop my asthma meds once I'm pregnant? What about allergy shots? And the most important message I share in this episode is this: well-controlled asthma is safer than poorly controlled asthma in pregnancy. Oxygen matters for mom and for baby. We also talk about safe antihistamines like loratadine and cetirizine, why nasal steroids like budesonide are still first line, what to avoid like systemic decongestants, HEPA filters, dust-mite strategies and travel tips, allergy shots and when to continue versus start, biologics like Xolair and Dupixent, and even the fascinating topics of progesterone reactions during fertility treatments, which I think I still have some questions on. If you're trying to conceive, currently pregnant, undergoing fertility treatments, or supporting someone who is, this episode will give you clarity and reassurance grounded in evidence. I'm so grateful for Dr. Bove for hosting this conversation and allowing me to share it with you here. Let's dive in.
Hello, my loves, and welcome back to the Love and Science podcast. I am so excited today to have a friend and a colleague on the show, Dr. Kerry Reller. We've been talking about doing this podcast for so long. She is, like I said, a friend and a colleague. She is the owner of Clearwater Family Medicine and Allergy in Clearwater, Florida, which is such a beautiful place to be. Her practice encompasses family medicine, obesity medicine, allergy, and more, which is amazing because we have not yet had anybody come onto the podcast and talk about allergy medicine. I have so many questions. I can't wait to get into it. But basically, with the combination of these passions, she helps patients live their healthiest and best lives so that they can prevent chronic disease, move better, and breathe better, which is so cool that your family medicine and allergy, because I feel like it's just like such a comprehensive way to look at things, which is amazing. And really your jam is lifestyle changes so that people can live their best lives. So welcome, Dr. Kerry. It's so great to have you.
Thank you so much for having me. I'm very excited to be here.
Absolutely. And another fun fact about Dr. Reller is that she went to Notre Dame just like I did. And so go Irish. Go Irish. Okay. So can you share a little bit about your story in terms of how you came to do what you do?
Yeah, so my story's too long, but I'll briefen it up. So at Notre Dame, I did electrical engineering and ended up going to grad school, working a little bit in engineering. And I found out I didn't want to work behind a computer screen all day. And I really wanted to more have a relationship with people, interacting with people. And I had initially intended to do like a biomedical type thing. I learned about going back to school for, I guess, medicine from some post-baccalaureate people that were out of Hopkins. So I ended up doing a post-bac thing and ended up going all the way into medicine. So a professional student is one hat I wear, and I'm always learning. So this is exciting. But so I was initially engineering and then went into medicine. And I was going to go into sports medicine, radiology at one point, electrophysiology at another point. And then I decided I think sports is what I want to do. So I went into family medicine and I loved every aspect of it. We get to do so much in family medicine. But I grew up with an allergist father, and he wanted me to move home and learn everything he did and give me that opportunity to actually be a business owner too. So my husband and I picked up and joined him in practice, I guess almost 10 years ago now. And I took over a couple of years ago. So he taught me all the allergy and asthma aspect of everything. And I didn't end up doing sports medicine, but that's how we ended up doing so many different things. I love doing it all. It really keeps my day exciting and different. And I really just continue to keep learning more and more. So I have lots more to say, but I'll end it there.
Yeah, no, that's amazing. And we all have limitations of our knowledge. And I've got very little training in allergy medicine. I know very little about it. And so when my patients and my clients come to me and they say, I've got the worst allergies, can I do this or that or the other? I'm just like, I like freeze. I'm like, oh, I got to phone a friend because I don't know the answers to their questions. I'm hoping that clearly too, allergy has evolved a lot since we were in medical school as well. Like you said, like always learning, but thinking about people who might see you who are maybe trying to get pregnant. I'd say that's the people who listen to my podcast are trying to get pregnant, or maybe they're newly pregnant and wondering like what they can do. What are some things, some sort of basic guidelines that you have learned to help counsel people who are in those two phases?
Yeah. So I think that's an excellent question. I think sometimes allergies are accompanied with asthma and eczema, right? And I think that is one of the biggest things to remember is that you have to have good asthma control or things can actually not be so great for pregnancy. So one of the first things I would say is make sure everything is under control before getting pregnant or in being pregnant. So not stopping inhaler medications, right? Because if indeed you did get pregnant, the oxygen demand that is required for the mother and the fetus is super important, right? So we always like to say, just don't stop those inhaler medications. They're safe in pregnancy, they're safe in preconception phase, and continuing your care is probably one of the most important things, right? As far as controlling allergies oftentimes going to control asthma as well. So the basic things that are pretty harmless is like a nasal saline irrigation, right? You can do that kind of thing at night, and avoidance, right? So avoiding your triggers, right? If you have a cat or dog, keep them out of the bedroom, bathe the dog once a week, get a HEPA filter. So we like to recommend those, especially in someone's home, so that they can filter the particles, whether it's connected to your air conditioner or a separate standing unit. I prefer those separate standing units for some patients who have more symptoms, and it really can help purify their air. And there are some that even will kill viruses and things like that. So that can be simple add-ons. Obviously, cost effectiveness can be helpful too. Costco always has those things on sale, so you could use those. And then the other things that if you're having a lot of post-nasal drip, and that can irritate the airways eventually if it keeps going down and affect asthma. So we want to talk about reducing the allergens, but also decreasing the inflammation and the mucus production that could be making things going on. The antihistamines are usually fine during pregnancy. The two most tested would be Claritin or loratadine and Zyrtec, and that is cetirizine. So those are probably the two tried and true most tested H2 antihistamines. So they're less drowsing and don't affect like infants or yourself as much. And those I would recommend. The other Allegra is pretty good too. I always like to say Allegra doesn't cross the blood-brain barrier. It makes people less, it's not usually drowsing for that. So those are two like major simple things you can do. Nasal steroids are still first line though. And the one that has been tested the most is actually Nasacort or budesonide nasal steroid. And you can definitely continue that during preconception phase and during pregnancy. And that can help that postnasal drip. It can decrease the inflammation. It can help with runny eyes, watery eyes, itchy eyes, all of this stuff. So it is still first line in general in allergy. And if you love Flonase, which is a different brand, which is fluticasone instead of the budesonide steroid, it's probably okay too. But the thing is that it's a matter of how much has been tested. And I would say Nasacort has been undergone more testing for that. The biggest thing is controlling that. And one, we talked about the breathing. The other would be controlling the inflammation and things like that. Because if you're having allergy symptoms, it's still worth treating. Otherwise, you're going to be tired all the time, running. You're not going to want to do things to get yourself in the best health. And the other thing I would say is it's not going to help you sleep very well either if you're having lots of allergy and asthma problems. So those are the biggest things to help keep your baseline up, if that makes sense. I want to stop there because
No, this is all like new information to me. So I can't wait for our listeners to get all this wisdom. I've heard good things about HEPA filters, but I really didn't know much about them. Are there any other environmental changes that people can make that can like help with prevention?
So I think like we talk about lots about dust mite avoidance if someone is allergic to dust mites. Now, I guess the question also would be, should someone undergo allergy testing while pregnant or thinking of conceiving to know what your allergen triggers are, right?
Yeah.
I think it's safe to do that in the preconception phase. I probably wouldn't want to necessarily start a testing on a pregnant person because there is the risk of anaphylaxis during the test. It's very low. It could happen. So I probably wouldn't start the workup, but you can definitely continue the workup. We talk about dust mite avoidance, and it's like modest improvements. I mentioned the cat and the dog and things like that, but dust mites, you can get a mattress pad under your sheets. You can take it off, wash it once a week in hot water. You can fluff your pillows in the dryer for 15 minutes. If you want to be perfect, you can encase your mattress in one of those plastic coverings that says they're allergy proof. And they're really just keeping the dust mites from infesting the bed, if that makes sense. But these bugs live in your bed. You can't see them, you can't feel them, but they do sometimes cause a lot of allergy, nasal congestion, postnasal drip, and things like that. So especially if you notice your symptoms are worse in the morning, like that's somewhere you're spending at least, hopefully 8 hours at least, and in at a time. So therefore, if your symptoms are worse in the morning, the dust mites can be one of those problem things for you.
That's really interesting. Any advice when people travel and maybe the hotels, and because I feel like a lot of our people are going to conferences or going to different climates.
That's definitely harder. I would say with the dust mites, hopefully there's not much you can do there except for the nasal irrigation and things like that, and steroid nasal sprays before you leave. You would want to start that if you're not already doing it on a regular basis. And then a lot of hotels have feather pillows and people are allergic to them. So if you knew you're allergic to feathers, you could ask for a non-feather pillow. I do know like the hotels are doing like different things. They like barely have comforters on the bed and things like that. I think that they're doing a little bit helpful things with cleaning there. Most of those places all have carpeting, and that is a dust mite haven. But I can say that their humidity in the hotel rooms are very bad, and dust mites like humidity. So don't go turning on humidifiers, I guess, where you are if you have dust mite allergy or mold allergy or something like that.
Really good to know. Now, one thing I hear a lot about, and I always have to talk with the allergist, is like the shots, right? I don't even know, maybe clarify like what's in the shots, like how do the shots help? What about seasonal allergies? Because I feel like that's especially for my patients with the worst allergies, they're like, I just have to get my shots. And then I'm like, I'm happy to talk with the team and everything, but can you clarify that for maybe people who don't know much about it?
Yeah, so allergy shots or subcutaneous immunotherapy is giving you a little bit of something that you're allergic to so that your body can create like a new immune response and doesn't overreact every time it sees it, right? So typically they start building up over time. Like we do a skin test and we will put in the customized solution based upon what the allergens are. So typically you'll have more than one shot. You'll have a weed grass mixture and then maybe like a mite a tree grass mixture, a weed mite mold mixture, and maybe an extra one for animals if needed. But you start really low, you build up over time. Now we will continue allergy shots in someone pregnant, right? If they're already at maintenance dose. So if they are already at the top dose and they want to continue them, that's perfectly fine. We know that they didn't have reactions and things like that. It's fine, right? Anaphylaxis is something that is not great to have when you're pregnant. That's definitely risk to fetus and everything. But we wouldn't necessarily start someone on allergy immunotherapy when they're pregnant. Now, pre-conception, like you could do that. The idea would be to try to get to maintenance before you would be pregnant so that you can stay on the allergy shots, if that makes sense.
Yeah.
They are usually a buildup phase. I probably wouldn't really recommend, there's like a fast buildup. I wouldn't probably recommend that. But allergy shots are generally safe while pregnant. If you are already on them, continue them and things like that. But we wouldn't necessarily increase dose or start a new patient who's pregnant on allergy immunotherapy.
Makes total sense. So what I'm hearing you say is that if you're someone who suffers from severe allergies and you're considering doing the shots as your next step, maybe be very thoughtful about, okay, like we're going to work up to this, we're going to get that under control, and then start the process of maybe like an embryo transfer or fertility treatments or something like that. Is that logic?
Yeah. Yes, that does. And if you have like severe asthma, but it is controlled and it's allergic related asthma, it's probably wise to do that too, so that your asthma can have better control during pregnancy as well.
That's fascinating.
Yeah.
That makes so much
sense.
But
you're not going to start allergy immunotherapy if your asthma is not controlled. That's a contraindication as well.
Yeah, that makes total sense. I wanted to ask you a question about progesterone allergy. And in my career, I've seen a few patients with a true endogenous progesterone allergy. What'd you say?
I said, how is that possible?
I know. I've seen like 3 different patients who were allergic, like it would have a luteal phase allergy response. And then as soon as that corpus luteum would die down, that their symptoms would get better. And you can put them on Lupron, and that's helpful because then they don't have any progesterone, but it's hard on their bones and everything else. And I think that I have seen it can be very hard for people in that situation to then do fertility treatments because there's going to be some progesterone by necessity. There are like desensitization protocols that I've seen. And I just wanted people to know that's available if they haven't been told that by a doctor, that they can overcome their progesterone allergy if that's like the barrier of conception. But it's pretty rare. I think the thing that I see more often is that people have side effects, allergic side effects to the treatments themselves. And so we use this progesterone and oil. It's very interesting that our frozen embryo transfer rates are much higher when we give some intramuscular progesterone. So they're looking at like subcutaneous routes, which would be lovely, and other routes. But if you look at intramuscular progesterone compared to oral progesterone or vaginal progesterone, when the cycle is completely dependent on outside progesterone, a lot of people, especially if they have the peanut allergy, because there's some in the oil. So then we're talking about Liate or other compounded versions, or people even like they put the progesterone and oil in, and if they don't wipe off like the oil from their skin, people get these giant welts and fevers and all of those things. And so what thoughts do you have about, and I always wonder, okay, if somebody's having fevers because of their progesterone shot, like how is that helping, and like cytokines and inflammation and all of that? What are your thoughts about helping somebody in that situation? Because it's such a hard conundrum. And I feel like so many people want to do IVF, but they're having these reactions to the medications that support an early pregnancy.
So this is exogenous progesterone?
Yeah.
Because I think you said endogenous.
In the
and
beginning,
I was like, how is that possible?
that's a
This
true
person
allergy.
already has, progesterone.
Very rare. But this is like allergies to exogenous progesterone.
And you're right, because at least micronized progesterone is often made with peanut. So people with peanut allergy do need to get compounded progesterone typically. Yes. And I'm more thinking of hormone replacement therapy, but typically, I don't know if would be really much in the literature, but you can do testing as if it's like drug testing, and it may be more to the components of the progesterone than what is actually the actual hormone itself, right? Because if it's progesterone, your body makes that, so you can't really be allergic to what your body already makes. But the things that it's compounded with or made with, you certainly could be. So example would be polyethylene glycol. That's compounded with a lot of different product, and that people are allergic to that. I think even the COVID vaccine had polyethylene glycol in it, and we were testing people to that. It's not standardized. Obviously, penicillin testing, which we know lots and lots about, but we do these other types of testing that you could be sensitized to it, essentially penicillin desensitization. But I would say there's not protocols in place for this, so that it would be hard to determine that really. And I don't usually think of fever as like a sign of allergy reaction, simply more like an infection, but you mentioned cytokines and things like that, so it definitely could be related in that way. But I can't say it would be standardized. You would have to find a allergist in your area that would be willing to try something new, perhaps like off the books a little bit, to see if that could be something that they can test you for and then consider desensitizing, which would be the same thing as what we do with allergy shots. Maybe not in injection form, but giving you a little bit of the thing over time, so that you get, your body no longer recognizes as foreign, basically.
That's so interesting.
Same thing. I mean, you could potentially do something like that because we do that for like sublingual allergy immunotherapy as well. So
that's fascinating. And it makes me think, yes, like we can change the components. One thing that I try to do in my practice is if somebody really is allergic to the intramuscular progesterone and they don't want to do like one of the other formulations, sometimes you can actually do like a natural cycle frozen embryo transfer protocol where you're using some of the progesterone from somebody's body, and that, but not everybody people don't have ovaries or whatever else. But it is interesting, a lot of the stuff from the hormone replacement therapy, it's all hormones, right? So it's interesting to think about how to help people with these different situations. Okay.
I should also mention, I know we're not talking hormone replacement therapy, but sometimes estrogen replacement therapy can activate or aggravate someone with chronic hives and things like that too. So I should mention chronic hives because some people are on biologic medications, right, for that, and something like Xolair, and you could be on that for asthma as well, right? Or maybe you have multi-food allergy and you're on that for a food allergy treatment, so you don't have anaphylaxis if you were exposed to those foods. So when you're on, I think Xolair has pretty good data, right? So that's something for all those indications I just said, and Dupixent, which is also indicated for asthma, eczema, chronic rhinosinusitis with nasal polyps, and a lot of other, even COPD now actually, and for other indications that aren't as common. But those medications should also be continued during pregnancy, and there's getting good safety data on that as well. So I would not withhold those if you were controlled asthmatic on those medications while pregnant.
Okay, that makes a lot of sense. Okay, so I'm learning so much. Is there anything that we haven't talked about yet that you think that our audience really needs to know?
Sometimes people question some of these over-the-counter products that can be used. So some things to avoid would be topical phenylephrine. Once upon a time, we used to have oral phenylephrine. It was combined in some of these over-the-counter products. And honestly, it was proven to be totally worthless. Like it doesn't work. But the topical phenylephrine can be very helpful as like a nasal decongestant. And that is recommended to be avoided in pregnancy. Also, a decongestion should be avoided in pregnancy and in breastfeeding because it can reduce your supply, get rid of any supply you had for a breast milk supply. So those two should be avoided. Oxymetazoline, so that would be Afrin. We allow that as in short-term use. And we also, if you precede it with a steroid, you can use oxymetazoline on a longer-term use if needed to as a decongestion. So instead of a systemic decongestion like Sudafed, which is what I was going at there, or the phenylephrine local, you can use those other ones just like topically. And that's a little bit safer. I was trying to remember what else. So a lot of people have questions about Montelukast. It's been a question on if it causes mood changes in children and things like that. A lot of patients who are adults are completely stable on it, and it's one of their asthma medications. So I would say it is technically considered safe to continue. I probably wouldn't start somebody on it during pre-pregnancy or pregnancy phases. And that's just like it can be used in the pediatric guidelines as an earlier add-on, and then in adult guidelines as an add-on for allergy and asthma as well. So that is the trade name Xolair, if anybody was on that or concerned about that as well. Anything else that you're thinking of? There is intranasal cromolyn that we don't usually use that can be very safe in pregnancy. It has no steroid or anything like that. And that's a mast cell stabilizer. So it works in the pathway of allergy and can help control things as well. It also works for mast cell activation syndrome if you have any patients on that pathway.
I actually do have a patient with that right now. I think I was like doing a lit search before we got on because I was curious just about what's being talked about. I found a lot of studies on like the question of maternal diet during pregnancy and like allergies of offspring, or thinking obviously like you can't really separate unless it's a donor egg, like the genetics of the mother and the genetics of the child and allergy risk there. But I see a lot of data looking at children who are born with allergies and if there's anything in the prenatal phase that can mitigate that risk. And most of the data I saw were that like the studies were inconclusive or that conflicting data. Maybe the microbiome may have a role in.
Actually. Yes, I do think vaginal birth is, we think, decreased asthma and allergy in kids from a mother if they have a vaginal birth. I think that's because you're getting all the flora and everything during transmission. We also know that fetal outcomes aren't as good if the mother is not controlling her asthma. And then as regard to diet and things like that, I think, so if a mom is avoiding something, that means the kid would not be exposed to it. I mean, that's a theoretical possibility. And the genetics of food allergy is also a theoretical possibility. But the truth is, it's going to be the importance of exposing the baby to it during its lifetime earlier on, starting at 4 months, not withholding. We learned from that LEAP peanut study that you got to expose the infant at an early age to all these things so that they don't become allergic. And the other thing we learned is that if the child has eczema, and that's definitely genetic somewhat, it's hard to avoid these things, but that's how those food allergy gets in, right? The skin barrier is broken down, the food they're eating with their hands, that's the higher risk of getting a food allergy if there's eczema and broken down skin. So we say through the skin, allergies begin, through the diets, they stay quiet. So basically, I think eat everything that the mom wants to eat. That's great. I would go ahead and include don't withstand from anything except for whatever. They're not supposed to eat raw food for infection risks and things like that. But I would not withhold milk or peanut or anything like that. If the mother is not allergic, I would continue to eat these things and then definitely expose the child to them around that 4 to 6 month mark as well.
Oh my goodness. Dr. Kerry, I've learned so much from our conversation. Seriously, like I said, I feel like this was like a blind spot, and I like almost freak out when people ask me questions. So I'm like, I know nothing about this. This is going to be such a resource for people who have really high level questions. I'm sure people are going to want to follow you. Where can people follow you? Where should people learn about you? And obviously you have a podcast too.
I do. I have the Get Healthy Tampa Bay podcast. Says Tampa Bay, but it's really for anybody who wants to listen. And then you can find me at Clearwater Family Medicine on Instagram, Clearwater Family Medicine Allergy on Facebook, and we're located in Clearwater, Palm Harbor, Florida. Our website is cfma.health, and we always accept new patients, and we'd
Amazing.
love to partner with you.
Yeah, if you're in Florida, which I love Clearwater, I will visit there any chance I get because it is so very beautiful. But go see Dr. Reller, be her patient. I just adore her, and I know the quality of care she provides for her patients. And so if you live in that region and you heard something that resonates, go see her. If you live at a distance, then binge her content, please. Okay, my love.
The feeling is mutual.
That's right. Thank you, Dr. Reller, for being on the podcast, and I look forward to many more collaborations.
All right. Thank you so much. Take care.
Yeah. And to my loves, I love you. Bye.